We're going to talk about synthetic data, right? So I'll assume that you're not very familiar with synthetic data, so I'll start from the beginning. So what is synthetic data? In very high level, synthetic data is something that looks like the real data, but it accomplishes one thing, which is privacy. So you cannot see the name of the people, and it's more than kind of encrypting the patient and the physician. So it hides more information than that, right? And the key idea is that you can use the data freely, and maybe you can connect it with other data sources. So the question, I know you kind of know that, you have some ideas, but the question is, why do we need synthetic data, right? Why do we need that? So basically the three reasons. Number one is we don't have enough of real data. So for example, think of rare diseases, orphan drugs. You have a dearth of data. Second one is the data is not accessible. So we have HIPAA, GDPR, you've got all those permissions, the agreements, the TPA, just make it very hard for you to get the data, right? And the third one is we want to protect sensitive information. Just think of cyber attack that we had last year. We want to have some protection. Those are the other reasons that you can talk about, but those are the major reasons why you want to have synthetic data. So then the next question that you have is this synthetic data reliable, right? Okay, you can say whatever you want, but this is the fake stuff. How can I believe this thing, right? And so let's kind of try to understand that a little more. We say, okay, could you generate for me the height and weight of 1,000 people, right? Just generate them. Okay, so we know that if you do that, somehow the height and the weight, they're connected by something called the BMI, right? I mean, you cannot be very tall and very light. That's not possible, right? If the bones are very heavy, right? So you have to take into account the reality of the BMI, because we're human beings, so the two are kind of dependent on each other, right? They're not completely independent distribution, right? And then the next thing for the 1,000 people, how many men, how many women do you have? Because the height and weight differ, right? We're a dimorphic species. And then how many children, how many adults you have, and what is the breakout in terms of the ethnic group in your 1,000, right? So you see a question which is as naive or simple as give me the height and weight of 1,000 people, you'll have to go through those, and then you have to make assumption for you to be credible, right? Otherwise, you just cannot generate them like this. They're useless, right? So the challenge is, does the data look like the real data? The second one, does it capture the underlying dynamics, right? So the data may look like the real one, but there may be things that happen inside the data that are more subtle that maybe your generator doesn't capture, right? Maybe there are two diseases that are highly correlated or not so highly correlated. Are you taking that into account when you generate the data? Or maybe not. Or maybe that when something happens here, something else never happens, right? And it's very covert, it's kind of hidden. Maybe even the specialists are not very aware of that, right? So the synthetic data must do more than just match distributions. It has to reflect the logic and the constraint of the world of medicine, right? So the quality control must include clinical validation. I mean, you take an expert and a urologist and say, look, does that look real to you? And the guy says, oh, no, it doesn't make sense, right? Or it makes sense, but it's very rare. But in your data, you have it too frequently based on my opinion, right? So the second point is mimicking the real data is not enough. You have to capture the underlying dynamics. And that's the huge challenge that we have. So that's kind of what we were starting with. The higher the fidelity, the higher the fidelity of the data, the better. And as we said, well, not always because of the bias amplification, right? We need to be cognizant of that, right? There's another thing that you may think of is that we can think of this as a trade-off between feasibility and creativity. So you're generating the data and you want to be creative. Why? Because if you're already telling me what's in the data, your data is useless. You're just replicating what's already there. I already knew that. So the value of the synthetic data is the newness that you bring to the table. If you cannot tell me something I did not know, not in the data, it's useless because I could look at it myself, right? And the question is, when you invent the new data, is it real? Is that feasible? Is that real, your stuff, right? So if you're too creative, then you run into the feasibility issue, because then you're starting to, let's use the word hallucinate in the LLM, right? So you're going to make up things that are just impossible, right? So the kind of the maybe the Goldilocks synthetic data would be creative enough, but then respect the fidelity or the accuracy or the feasibility of what's going to happen. So somehow that I draw that red line, dotted line, it would leave on the boundary. Those are the very interesting data points. You don't want to cross over because those are unrealistic things that cannot happen. But you want to be creative, right? So that's basically, in my mind, the kind of ultimate challenge of synthetic data. Be creative, but don't hallucinate, right? And it's difficult to do.